So this is part two of how I became a labor and delivery nurse. So if you haven't checked out part one, make sure you go do that, and this will make a lot more sense. So yes, I made some connections with my local hospital and their birthing unit, and then I was able to work as a PSW or a personal support worker. I think they called it a summer care provider role, and it was basically just for nursing students. So I worked at the hospital there, and that helped to get me the connection on how to shadow on the unit. And then I worked through my university to be able to get me the placement in labor and delivery. Again, every university has a little bit of a different system on how they rank who gets what position and, your top three choices of where you want to consolidate. So this is what I did, and I was lucky enough to get a position on the birthing unit. So after my consolidation, the hospital I was at wasn't hiring new grads for that area. So I applied to every single labor and delivery, postpartum, maternity, maternal child, any position I could see that was available, I applied to. And then I did end up getting hired on a postpartum unit in the city. And I worked there for about 3 months training as a new grad nurse, which I think was actually amazing. It was perfect as a, new nurse. It gave me the chance to learn how to be a nurse on my own before I stepped into labor and delivery. And then after those 3 months, I started my training on labor and delivery. And I've been there ever since, and I absolutely love it. So yeah, number one advice I can say is make connections, do your research, and do some extra courses. Build your resume so that they know, okay, this this person is really interested in working in maternal child nursing. There's so many opportunities out there that you can do. You can even do a breastfeeding course, like a 20-hour breastfeeding course through the RNAO. There's lots of different options. Put that on your resume, get it together so that when you throw in your resume for consolidation, they know that you're interested. And then once you get your consolidation on the unit, you have that experience and they will hire you most likely, or at least somewhere will hire you because you just need that experience on your resume. If you guys have any other questions, make sure you leave them in the comments below. And if you are a nursing student or you want to be a nursing student, you want to work in labor and delivery, make sure you follow along for more tips and tricks from my experience as a, junior nurse in Canada working on labor and delivery.